What is zoonosis? Zoonosis is any disease that is transmitted from vertebrate animals to humans. It is caused by pathogens such as a bacterium, virus, or parasite. The word zoonosis is derived from Greek words zoon, which is animal, and osis, which is disease. Did you know that there are over 200 types of zoonotic diseases that can be directly transmitted through air, bites, and saliva, or indirectly transmitted through intermediate species called as a vector which carry the disease without actually getting sick? Few of the most known zoonotic diseases are leptospirosis, which is caused by a bacteria that is present in the urine of an infected animal that can spread through water and soil. Rabies, which is a virus that is caused when infected saliva enters the bloodstream. It spreads when a warm-blooded mammal licks on an open wound or bites or scratches another warm-blooded mammal. World Zoonosis Day is held every year on the 6th of July worldwide to commemorate the work of French biologist Louis Pasteur, who successfully administered the first vaccine against rabies on the 6th of July in the year 1885. Rabies is a deadly virus that attacks the central nervous system of the infected warm-blooded mammal. A human who gets rabies may go into coma and die. These are some of the warm-blooded mammals that can get and spread rabies. It is not easy to diagnose rabies in animals since it is a combination of several symptoms such as extreme salivation, unprovoked or inexplicable irritability, inability to swallow, ascending paralysis, changes in the animal's behavior. But all these may not be the signs of rabies alone. The only true test for rabies is the post-mortem that is conducted by the vet. Some symptoms of rabies in humans can be hyperactivity or excitable behavior, hydrophobia, which is fear of water, or aerophobia, which is fear of air, paralysis of muscles, convulsions, hallucination, or confusion. The incubation period, that is the time between the bite and the signs of rabies appearing in a human, is usually within 1 to 3 months. But it could take less than a week or more than a year to show the signs. As we know that rabies is incurable, we must take all necessary measures to prevent it. WSD recommends all those individuals who interact with animals regularly to take their pre-exposure rabies vaccinations as prescribed by the doctor. What should you do if you get bitten, scratched, or licked on an open wound? You can follow the below steps. Step 1. Wash the wound under running water for 15 minutes with an antiseptic soap that removes almost 98.4% of the virus. Step 2. Clean the wound with an antiseptic providine such as betadine. Step 3. Visit your doctor within 24 hours of the bite and take the post-bite rabies vaccination plus the tetanus injection as prescribed by the doctor. Taking tetanus injection is mandatory if a dog or a cat bites or scratches you, since their paws might contain dirt particles which can cause tetanus. It is very important that you do everything that the doctor says. The post-bite rabies vaccinations are administered in 2 ways. The first way is the intramuscular regime, which is 4 doses in 3 visits. On day 0, which is the day of the bite, 2 doses are administered on each of the deltoids. On day 7, 1 dose is administered on any one deltoid. On day 21, 1 dose is administered on any one deltoid. Single dose of the intramuscular vaccine is the entire vial regardless of the brand. The second way is the intradermal regime, which is 6 doses in 3 visits. On day 0, the day of the bite, 2 doses are administered, 1 on each deltoid. On day 3, 2 doses are administered, 1 on each deltoid. And on day 7, 2 doses are administered, 1 on each deltoid. Dose of the intradermal vaccine is 0.1 ml regardless of the brand. In case of multiple and severe bites, a human rabies immunoglobulin is administered only once at the bite wound along with the post-bite rabies vaccinations. This provides immediate antibodies until the body can produce its own antibodies against the rabies virus. There are some other preventive measures that can be followed. 1. It is recommended to get your pet vaccinated by your vet and get other street dogs near your area vaccinated by calling the nearest animal welfare organization. 2. Get the street dogs sterilized to help reduce the excess dog population that may not be properly cared for or vaccinated. WSD conducts a mass vaccination program every week for the street dogs in Mumbai. 3. Do not directly touch or pet a dog that you don't know. 4. Call a BMC official if you find a rabid animal. So let us make this world a healthier place, and we wish you a happy, safe, and healthy World Zoonosis Day.